the News Channel 5 network, this is OpenLine.
Hello everyone, welcome to OpenLine. Very good show tonight. We're talking about the Affordable Care Act, signing up for the Affordable Care Act. We have people with us who can answer any question that you may have. And the deadline, if you want coverage by January 1st, is December 15th. That's Monday. So let's bring in the people who can answer your questions. Happy to have with us Jackie Schrago and Mary Hunt, both with Get Covered Tennessee. Thank you both for being here.
Glad to be here. Thank
you. A
you.
lot of talk last year about all of this. Now we're another year into it. How are we doing? How is the website? How is it working? What are you seeing right now?
Well, it's working very well. Mary and I think we're about as busy as we can be. We have lots of people who are signing up, lots of people renewing, paying attention to being a good consumer and checking things out. We want them to do that. We have a new 800 number where it's possible to call and get a face-to-face appointment with somebody, so you can set that up in advance. One of the things we learned last year is that people really do need face-to-face appointments.
Yeah, they are a little overwhelmed. It can be a little overwhelming.
Yes.
So it helps to have that face-to-face appointment.
And it helps to have somebody just to be sure I understand what are those questions, how is it working, you know, how do the plans work, even if you think you know insurance, and many people do. Or maybe what we should say is many people know how to work a computer, but they don't really understand all the things that this is asking about. So that's where the questions come in.
And so we want to encourage you to call in. There's the number at the bottom, 737-plus, 737-7587. If you have questions, this is an opportunity for you to get some of these questions answered. And Mary, what do you see? I mean, you're there every day taking these questions. What are some of the most common that you're getting?
The most common questions would be, can I keep the doctor that I'm seeing right now? I mean, just in general, what are the differences between the plans? Because folks see, 70-something different plans when they first go on, and they're wondering, why are they different prices? What's affecting the premium cost? Because some plans may appear to have the same details, the same deductible, same out-of-pocket maximum, but very different monthly premiums. So folks are wondering what's behind that. And there's several things. It could be the carrier, it could be the network of doctors or the options of doctors and hospitals that you have that's contributing to that difference. So that's the main question, is what's the difference between all of these plans? 70
plans. Are we fortunate in Tennessee to have that many plans? That's a lot of competition.
Yeah, it is. And what it does is give people a chance to figure out what's the best fit for their family and their situation. Mary mentioned the very most important thing about a lot of that, which is the network, and that's one of the things that we want to be sure people understand. So in the past, when people bought insurance, they thought they wanted to be able to have all the choice in the world, and insurance companies said, okay, but they charged for it. Now that people are saying, well, wait a minute, my cost of insurance is too high, can it be lower? The insurance companies are saying, sure, but you have less choice. So you choose for yourself, your family, your situation. Do you want all the choice in the world, and do you want to pay more per month? Or will you take fewer choices of doctors and pay less per month? Your choice.
And what are the price ranges we're talking about here? It's from X to X. I mean, what's the range?
Well, it depends on your income.
That's a very difficult question to answer. That's also one of the most common questions. How much is this going to cost me, of course.
Right.
But it depends on so many different factors. There's the household size, the income, the ages of the folks in the household, geographic area in Tennessee. So there's different things that affect it. But some folks, I mean, the price range starts anywhere from $0. There are actually some folks, younger folks with lower incomes, who can qualify for plans that are absolutely free, because the tax credit that they're eligible for is actually more than the cost of the plan.
Okay.
So that's a message that we really like to get out. Of course, there's usually more comprehensive options. That's going to be more of the catastrophic level coverage, but it starts at $0 and goes all the way up from there.
And I guess let's explain the tax credit and that kind of thing too.
Okay.
That is something that would be figured into the cost.
That's right.
Even though you get the tax credit at the time of the taxes.
No, you get the tax credit each month.
Oh, okay, each month even.
Yes.
Okay, great.
So what happens there is so if you are eligible for a tax credit, the amount you see when Mary says $0 or $10 or $20 or $50 a month, that's already taken into consideration you're due a tax credit.
Okay.
So the balance of that goes to the insurance company directly. Now, it's reconciled when you actually file your taxes, and for this year we'll be filing taxes in April 2016. We're always doing this sort of in advance. So we're looking at and asking people, what's their income for 2015?
Right.
And then we make an estimate of that with them. They verify that that's reasonable. They get a chance to change it during the year if it's appropriate. But then the tax credit gets paid in advance over the course of the year. And then only when they file their taxes next year would it get reconciled, if you will.
And what about the other thing that people talk about is the fine or the fee or the charge if you don't sign up at all? There was nothing, well, I'll just let you explain that. What happens there?
Well, it doubled this year.
Okay.
It doubles for 2015. So it was like $95 for a single person, or about 1% of your income.
Last year was
Last year.
$95.
Yeah.
They haven't paid it yet. So if they didn't sign up in 2014, they'll be paying that this tax season.
That'll be
So
something they have to
that's
pay.
a little
Yeah.
tricky, is that no one has actually paid the penalty yet.
Okay.
So if they make $25,000 and they think, especially somebody who's young and think, I don't need insurance, they're going to pay a $250 fine in April of 2015 based on not having insurance for 2014.
Okay. And then
And that will double.
it'll be
if they-
$500 fine. Wow. And do people know that? Do you feel like people understand those kinds of things? It's critically important to this program that people sign up.
Right.
So the Obama administration, really focused on getting people to sign up, especially young people. That's critical. You're saying you're really busy right now. Do you feel like people are signing up? Will you reach way more than you did a year
think so.
ago? Or how about the numbers that you're seeing sign up?
There's been a good mix of folks who are renewing, but I've also had an extraordinary number of people who just missed the deadline last time. Maybe they went to sign up on the last day and something happened. They just missed it. So they've actually been waiting in line all of these months, and they were ready to go at the beginning. And part of that is knowledge about the penalty. Everyone has different motivations for signing up, but the penalty can be a big motivator, especially for younger folks.
We think more people are just more aware of it this year, and it's been, and people are more aware they need insurance. So there are more people saying you need insurance. And remember what we're trying to do with insurance. The reason for all this, some of the difficulty, is that without getting everybody covered, it then becomes very expensive. We don't need just the people who are going to be the most sick. Insurance works just like we don't want a fire to happen in our household, but we all pay for fire insurance. Why? Because on the one-off chance that my house catches on fire, I want it to be covered. So I'm willing to pay a little bit every year so that doesn't happen. I hope you don't have a fire or you don't have a fire either.
Right.
But because we're all paying into the fire insurance, it's all much lower. And that's what makes it work with health insurance as well.
And that's why it's important that more people sign up this year than last year. You keep seeing an increase.
Right.
Exactly.
There were 500,000 people who signed up and selected a plan in the first week nationwide.
Okay.
That's a pretty good number.
Good. And in Tennessee, people
We don't have
are aware. I mean, do you feel like even now, I guess this is an opportunity too. What do you want people to know? I mean, I'm kind of surprised Monday. Okay, so that's coming up soon.
It's, yeah, a few
So
days
get
from now.
on the computer and sign up, right?
Right.
Or call
Right.
or do whatever. But this is a critical time here.
Right.
And that's what you want people to kind of take away, be aware
Yeah,
of.
and this is a critical deadline if you want it starting January 1. If you want to wait, and you just, the very last date is February 15.
Okay.
Okay? But then you don't have it right at the beginning of the year. And you will pay a prorated penalty for every month you don't have it. Now, we should mention that there's some people we know fall into the gap here in Tennessee, because at this point, our governor and legislature have not expanded Medicaid. So we have, if you qualify for TennCare because you have young children, essentially, then you are eligible for government-sponsored insurance through the state. If you don't have young children and you just don't have enough money, you don't get a penalty. But we urge you to go ahead and sign up, because if things change for you during the year, I mean, we talked to a number of people who are unemployed, okay? who've lost their job. They don't think they have income. We urge them to go ahead and sign up, because then they get an exemption from the fine, and if their situation changes, guess what? They get a chance to get insurance whenever they have some income coming in.
Okay. And that is a big issue, because yes, you've been on before, and that a lot of questions about, am I covered, my income is this, and there are a lot of people that right now they are not.
Right.
And generally speaking, now I remember what the numbers were last year. What were those numbers? Who was in that donut hole, or whatever you want to call it?
Well, there's a lot of variation on how many, what the numbers are. It's at least 180,000 people in Tennessee.
Okay, a lot of people. All right, we're going to take a break. If you're on the line, hold on. If you want to call, there's the number, 737+, 737-7587. We'll take a break. We'll be back right after this.